Hello everyone, I am Dr. G.V. Nagarjun Reddy. I am a consultant head and neck surgical oncologist at Mallareddy Cancer Hospital and Research Institute. So what are head and neck cancers? Head and neck cancers are the cancers that arise or involve the regions of skin of head and neck, or the cancers that arise from the sinuses, the nose, or the cancers that arise from the oral cavity, that is the mouth, cheek and lip or tongue, and also the cancers that arise from the larynx, the so-called throat, and the cancers that arise from the thyroid gland. So what are the causes of head and neck cancers? So use of tobacco, that is in any form, that is smoking form or a non-smoking form. The smoking form of tobacco includes use of bidi, cigarette, hookah, chutta or even e-cigarettes. Poses a risk for head and neck cancers. Use of tobacco in non-smoking forms such as pan, zarda, gutka, tambaku also poses a very high chance of head and neck cancers. Consumption of alcohol also increases the chances of head and neck cancers. Combined use of tobacco and alcohol at the same time multiplies the effect. Exposure to certain chemicals such as people working in rubber industry, heavy metal industry and wood industry are also prone to develop head and neck cancers. Some infections such as infections by EBV or Epstein-Barr virus or HPV virus are also prone to cause head and neck cancers. Nowadays, there is an increasing trend of HPV related cancers in India. Very rarely and very few cases of head and neck cancer are also related to genetic causes or syndromic causes. These people are also prone to head and neck cancers. So what are the symptoms of head and neck cancers? The symptoms of head and neck cancers vary according to the site. The most common head and neck cancer that we see in India is a oral cavity or mouth cancer. Symptoms of a oral cavity or a mouth cancer are a non-healing ulcer on the tongue, cheek or gums that is not healing within 15 days, or it is persistent for more than 2 weeks. A bleeding from mouth, a burning sensation upon eating a spicy food, swelling of the jaw, and a toothache that is not subsiding or persistent for more than 15 days. So what are the symptoms of throat cancer? Throat cancer patients present with commonly change in voice, that is hoarseness, difficulty in swallowing, painful swallowing, bleeding or vomiting, foreign body sensation in the throat. So symptoms of thyroid cancers. Patients present with swelling in the neck, in the region of thyroid, or a change in voice, or difficulty in swallowing. These are the different symptoms of thyroid cancers. Symptoms of nose or paranasal sinus tumors are nasal bleeding from the nose, nasal obstruction that is persistent for more than a month, facial swellings causing deformity of the face, vision problems such as double vision or restricted vision of the patient. Symptoms of skin cancer. Skin cancers are more common in light-skinned people and people who are exposed to UV light more often. So what are the symptoms? A recent change in the size of the mole, shape of the mole, which is painful and which bleeds on touch. Prevention of head and neck cancers. Head and neck cancers can be prevented by following simple measures. That is, avoiding use of tobacco and alcohol, eating a diet that is rich in antioxidants, that is fresh fruits and vegetables, maintaining a healthy lifestyle, and taking precautions for people who are exposed to some special risk factors such as some chemicals. Apart from that, early diagnosis and treatment of pre-malignant lesions could prevent the conversion of pre-malignant to malignant diseases. And the final most is vaccination against HPV. Vaccination, that is, role of vaccination against HPV in head and neck cancers is evolving, but it prevents against other cancers such as cervical cancer. Mallareddy Cancer Hospital and Research Institute is a comprehensive cancer care center where we are equipped with latest technology and equipment to treat our patients. We have a latest fiber optic flexible laryngoscopy equipped with narrowband imaging for early detection of precancerous and cancerous lesions of throat. We use lasers for treatment of early glottic cancers, that is early voice box cancers. We have nerve monitoring system that gives us zero complication rates in thyroid surgery. We have latest radiation equipment for organ preservation protocols in laryngeal cases, that is laryngeal cancers. We have immunotherapy for recurrent head and neck cancers at Malla Reddy Cancer Hospital and Research Institute.